Dear Dr. Tedros, we are very honored to meet you in person. Thank you for considering our appeal, an appeal made to all ministers of health and their representatives of the member states who are now at the 74th World Health Assembly. This is an initiative of Doctors for Extinction Rebellion and other movements. They are all here in front of you. We are supported by the Global Climate Health Alliance and the Global Strategic Climate Communications. Already at the COP21, the WHO alerted the world. Climate change is the greatest threat to global health in the 21st century. As frontline health workers, we are confronted every day with the consequences of environmental deterioration on the health of our patients and communities. I'm just back from Africa and I saw it again. I worked there and I was really stricken, and it's happening in the north also now. So what we see are respiratory and cardiovascular diseases due to air pollution, lost work days and death due to heat waves, over and undernutrition due to lack of quality food, diarrhea and poisoning due to polluted drinking water, and also psychological distress due to natural disasters and loss of hope. Unfortunately, health professionals are not listened to, nor are scientists in general. Global warming is not only an existential threat for future generations, but a reality now. This is especially dramatic in tropical countries, where malnutrition is again on the rise. Despite accumulating evidence and repeated warnings from climate scientists, despite more frequent and severe natural disasters, including the COVID-19 pandemic, the concrete actions implemented by our governments are far from sufficient in view of the urgency of the situation. In the face of inertia, inaction, and the abysmal gap between speeches and action, we, the health professionals, demand that the health authorities in each country publicly declare that climate change is putting people at risk of death. We demand that the health authorities act now to preserve life. You, health authorities of the member states, are responsible for making climate change and biodiversity loss the #1 public health issue. You, the health authorities of the member states, are responsible for rapidly restoring a safer climate and ensuring the best possible protection for all, especially the most vulnerable. You, the health authorities of member states, are responsible for forcing your governments to comply at a minimum with the Paris agreements. You, the health authorities of the member states, are responsible for acting in your field, the field of health. Here are some concrete action. Give priority to prevention and health promotion. Promote a more sober, more human, more equitable medicine, especially here in Switzerland. Develop environmentally friendly medical practices and health infrastructures. And also involve the population and patient in strategic choices. Dr. Tedros, we ask you to relay our concerns and determination to the ministers and representatives of member states attending the World Health Assembly. We ask the WHO to be the driving force and guarantor of public policies that respect the health of all and preserve life. The urgency must be declared and proposals for implementation developed both this week and at the G7 summit in the UK in June. As health professionals, you and we are responsible for the health of our population. That it is why we must act now. Thank you for your warm welcome. We wish you a fruitful World Health Organization Health Assembly, especially on the burning issue of climate and health. We count on you.
Merci beaucoup, Valérie. Thank you.
Jeanne, I'm a nurse, and here is the letter for you.
Okay.
Please take it. You can read it.
Okay.
And these are the signatory of the health professional worldwide.
Thank you.
You can pull the ribbon and see the signature.
So you want me to sign?
Yes. Huh. Thank you. More than 1,000.
Shall I?
Yeah.
Oh la la. Yeah, thank you. Thank you. Yeah, thank you. Okay. So can you? Yeah, thanks.
Dr. Tedros, we still have an intervention from Mr. From the Caribbean, and then Richard Horton.
Then
and
I speak after
And then you
that.
speak after
Okay,
that.
d'accord.
Thank you.
This is mine. This is mine.
Yes, this is yours.
Richard Horton, you can talk. Ah, no. Who is there? Yeah.
Okay, Richard, you can continue.
Il n'y a pas de son.
Stand in solidarity with all health workers for Extinction Rebellion and the World Health Organization at a moment of unparalleled global crisis. It's an acute crisis, a global pandemic, but also an acute on chronic crisis, a syndemic, a synthesis of epidemics. Yes, a coronavirus, but a coronavirus that has created untold human carnage because of pre-existing poor health, devastating and increasing inequality, and environmental and social destruction that has created the conditions for new pathogenic viruses and variants to exert their lethal effects. Already, we see the beginnings of Western complacency, the tragically mistaken view that this pandemic will soon be defeated. Not so. The shocking disparity in vaccine access means that this pandemic will endure and threaten us for several years to come. And there is a lesson here as we confront the environmental emergency, the climate crisis before us. The COVID-19 pandemic has taught us that those countries that took early and decisive action protected the health and welfare of their citizens more successfully than those who delayed. The costs of inaction can be counted in the preventable deaths of millions. The costs of inaction can be measured in the scarred economies of countries that hesitated. The costs of inaction can be seen in the shadow cast over the futures of children and young people. The Lancet's countdown on health and climate change has documented sharp increases in heat-related mortality, higher risks of infectious disease transmission, and rising food and water insecurity. But the climate crisis is not merely a threat to health, it is a threat to life itself, all life, the intricate, delicate, and interdependent connections across the living world. The World Health Organization was the first to warn the world about the coronavirus pandemic in January last year. Most presidents and most prime ministers ignored WHO's warning to their cost. But that lesson of the dangers of delay is slowly being learned. The climate emergency is a much more far-reaching public health emergency of international concern than COVID-19. It's now time to accelerate our actions towards decarbonization, to accelerate progress to a less polluted and obesogenic environment, and to accelerate our commitments to education, employment, and social care, all in order to create the conditions for pandemic and syndemic preparedness. In one word, equity. Thank you.
Thank you, Richard Horton, Editor-in-Chief of The Lancet. Thank you very much for your intervention. And now we will have James Hospedales, former Executive Director of the Caribbean Health Public Agency. He will also talk to us from distance. Thank you, Dr. Hospedales.
Thank you, Valerie. Good day, DG. This is a joint statement from myself and Dr. David Johnson, Chief Medical Officer of Dominica, who could not join us today but sends his support. We thank Doctors for Extinction Rebellion Switzerland who made this happen today. Your courage and that of climate activists everywhere is inspiring. We in the Caribbean witnessed firsthand the tragic impacts of just 1 degree Celsius of warming, including a wild hurricane season which destroyed lives, homes, health facilities, and health determinants such as water and food supplies. Services disruption to people with non-communicable diseases drives excess deaths beyond the storm's direct impact. And the NCDs themselves flourish in a world that's not designed for walking or biking and too often promoting high carbon, unhealthy food to busy citizens. Because of this, climate change is the imperative of the Caribbean small island states to meet the 2030 SDGs and not continue to be caught by surprise. For example, following the devastation caused by Hurricane Maria on September 18, 2017, which destroyed 225% of the GDP, Dominica embarked on a journey to become the first climate resilient nation in the world, outlined in the National Development Strategy, based on 5 Ps: people, planet, peace, prosperity, and partnership. Dominica has since established by law the Climate Resilience Execution Agency of Dominica. Health professionals worldwide need to awaken to the climate and health crisis and act. Indeed, it is the actions of Doctors for Extinction Rebellion which partially inspired the formation of Earth Medic and Earth Nurse, of which Dr. Johnson is also a director, to mobilize health professionals of the world to act on the climate crisis. We congratulate the DG for naming climate as the public health threat of the 21st century. Just as with COVID, Early, decisive, evidence-informed action will save lives and livelihood. We call upon DG and the ministers at the World Health Assembly to reaffirm that climate change is a health emergency and make the consequences of climate change, including reducing biodiversity loss, the #1 public health issue in action as well as in word. The new health goals must be to rapidly restore a safer climate, a prerequisite to human health and well-being, and to protect all people and species, especially the most vulnerable. In the Caribbean, we've learned a lot about disaster and emergency management, and I invite you to share and learn at our conference on climate change and health in SIDS, October 5th to 8th. For climate change at scale in our region, we need systems of financing based on vulnerability, not on per capita income only. But perhaps most of all, we need top-down honesty about the scale of the climate problem we really face, and bottom-up movements like the one we see here today. We implore you, Dr. Tedros, to take inspiration from this. I thank you.
Okay. Valerie, you're the boss. You should tell me whether I should continue or not. Okay. So I will start by thanking you for coming to WHO and also for your advocacy. And I would like to assure you that I'm one of you, and I'm with you, and I will be with you. Then what I will do is, this is a very nice description. It's also true for a human being. 35 degrees centigrade is okay. Then +2 is sick, means 39. Then +4, if it's 41 degrees centigrade, it's mortal danger. And if it's +5, it's too late. I mean, the way you described it, I hope will give sense to many. And you will have more friends to follow you. That's what I believe. And what I promise is, I will ask the member states if I can read this on your behalf to them directly before the assembly is concluded. If you agree. So I will say I'm reading this letter which I received on behalf of you, the advocates who came the whole way to hand over this to me and through me to the health authorities that are, or member states that are meeting here. So I would be honored to read it on your behalf to them. Deal? Thank you. Okay, so congratulations. Thank you so much for coming here. This is WHO, means this is your home. So your family. So you came home actually. So thank you so much, glad to have you.
Thank you.
Then I have a very formal one.
Oh.
Okay, my dear colleagues and friends, good afternoon and welcome to WHO again. Thank you for coming and thank you so much for your support. Your passion is contagious, of course, in a good way. Thank you for your unwavering dedication to caring for people here in Switzerland and around the world, and to speaking up for the most vulnerable. I also want to thank you for your service over the past 18 months. The world has come to a new appreciation for health workers and what you do. And you might know, WHO has designated 2021 as the year of health and care workers. I invite you to join our campaign, calling for countries to invest in health workers and to strengthen health systems everywhere. I have read your petition urging health authorities to act now for life, to recognize climate change as a health emergency, which I fully agree. And that's why we declared it also as such. So we're on the same page. To make the restoration of our environment a priority public health issue. and to create health systems that care for both people and the planet. We couldn't agree more. The COVID-19 pandemic has once again highlighted the intimate relationship between the health of people and planet. We depend on our planet for the air we breathe, the food we eat, and the water we drink. The pandemic has shown the world what it means to face a global threat. It has also showed us what happens when we are underprepared and fail to cooperate with each other. The risks posed by climate change could dwarf that of any single disease. The pandemic will end, but there is no vaccine for climate change. We have to act now, as you rightly said. We have to act now in solidarity to prevent and prepare before it's too late. That's your language again. In 2019, we established the WHO Civil Society Working Group on Climate Change and Health, which has been a forum for open and frank conversation on what needs to happen. We invite you to join that working group and work with us to foster ideas and drive change. The pandemic, as you know, has also provided a unique opportunity for building forward better, greener, and more socially just societies. It's encouraging to know that WHO has the support of so many health workers around the world in calling for a healthy green recovery from COVID-19. We need to stop making the same mistakes over and over again. This is the time to learn our lessons and act with sense of urgency. The pandemic has reminded us that health is not a luxury. It's a human right, fundamental human right. And that means everyone has the right to clean air and a healthy environment. We know what needs to be done, so together, let's get to work. Merci beaucoup. And thank you so much again. I will cherish this, and thank you. I'm very proud of you. And as I said earlier, I will read your message to our member states, asking for their permission, of course. Thank you so much.
Thank you. And as we have got less and less time, this is a gift for you. and we count on you and you all.
Yes. Merci beaucoup.
Thank you.
Merci beaucoup. That's great. Thank you. Thank you. Thank you. That's a wonderful gift, yeah. So I will be reminded that I am now your member, so with this. Thank you. Okay.
Thank you very much, Dr. Tedros. And we know that you are busy now to go back to the General Assembly, and we have just a song to accompany you going back to WHO. Thank you very much.
Thank you. Thank you. Thank you very much.
Les urgences, la mort et la souffrance, c'est notre quotidien de soigner son prochain. On sauve des humaines, la nuit ou la journée. Mais pour l'humanité, on doit prendre congé. Écoutez-nous, il y a urgence pour la santé de la planète et l'humanité. Nous sommes les Doctors for Excel. On a lu les rapports, on sait l'exponentiel. En a compté les morts, futurs et actuels. On voit que les politiques ignorent les scientifiques. Donc face à ce danger, on doit se rebeller. Écoutez-nous, il y a urgence pour la santé de la planète et l'humanité. Nous sommes les Doctors for XR. On descend dans la rue, on se couche par terre. On dit ça ne va plus, on ne peut plus se taire. Qui ne dit rien consent, il faut manifester. Car pouvoir et argent valent moins que la santé. Et